Hello everyone. Today we will talk about the axilla, which is really important topic and important part of upper limb. This topic will be divided into three main sections: introduction, borders of axilla, and contents of the axilla, which are crucial for exam preparation as they often appear on exams. The axilla is the name given to an area that lies underneath the glenohumeral joint at the junction of upper limb and the thorax. It is basically a passageway by which neuromuscular and muscular structures can enter and leave the upper limb. Now let's start with the borders first. The overall 3D shape of the axilla looks like a pyramid. It consists of four sides, an apex, and a base. Starting with the apex, also known as axillary inlet, it is formed by the lateral border of the first rib, superior border of scapula, and the posterior border of the clavicle. Now there are four sides or walls. Let's start with the lateral wall, which is formed by intertubercular groove of the humerus. The medial wall consists of serratus anterior and the thoracic wall, which contains ribs and intercostal muscles. The anterior wall contains the pectoralis major and underlying pectoralis minor and the subclavius muscles. Now the posterior wall formed by the subscapularis and teres major and latissimus dorsi. Lastly, the base is superficially covered by the skin. The size and shape of the axilla varies with arm abduction. The apex decreases in size mostly when the arm is fully abducted, leaving the contents of the axilla at risk of compression. The next part which we will discuss is its content. The content of the axilla region includes muscle, nerves, vessels, and lymphatics. Starting with the axillary artery, which is the main artery supplying the upper limb. It is commonly referred as having three parts: one medial to the pectoralis minor, one posterior to pectoralis minor, and one lateral to pectoralis minor. The medial and posterior parts travel in the axilla. Now there is this axillary vein. It is main vein draining the upper limb, and its two largest tributaries are cephalic and basilic veins. Now there comes brachial plexus, which is collection of spinal nerves that forms the peripheral nerves of the upper limb. Next is axillary lymph nodes, where they filter lymphatic fluid that drained from the upper limb and pectoral region. Axillary lymph node enlargement is non-specific indicator of breast cancer. At last, there is short head of bicep brachia and coracobrachialis. These muscle tendons move through the axilla where they attach to the coracoid process of the scapula. Now let's talk about the passageways exiting the axilla. There are three main routes by which structures leave the axilla. The main route of exit is immediately inferiorly and laterally into the upper limb. The majority of content of the axilla leave by this method. Another pathway is through the quadrangular space. This is a gap in the posterior wall of the axilla, allowing access to the posterior arm and the shoulder area. Structures passing through include the axillary nerve, the posterior circumflex humeral artery, which is a branch of the axillary artery. The last passageway is the clavipectoral triangle, which is an opening in the anterior wall of the axilla. It is bounded by the pectoralis major, deltoid, and clavicle. The cephalic vein enters the axilla via the triangle, while the medial and lateral pectoral nerves leave. Now our last part of this topic is its clinical relevance. The first one is the thoracic outlet syndrome. So basically, the apex of the axilla region is opening between the clavicle, first rib, and the scapula. In this apex, the vessels and nerves may get compressed between the bones. So this is called the thoracic outlet syndrome. The common causes of thoracic outlet syndrome includes trauma, which is fractured clavicle. Secondly, repetitive movements, which is commonly seen in occupations that require lifting of the arms. Lastly, cervical rib, in which an extra rib which arises from the seventh cervical vertebra. In this condition, it is often represented with pain in the affected limb. in which distribution of pain is dependent on which nerve is compressed, causing tingling, muscle weakness, and discoloration. So the next clinical relevance is lymph node biopsy. So approximately 75% of lymph from the breast drains into the axilla lymph nodes. So can be biopsied if breast cancer is suspected. If breast cancer is confirmed, the axillary nodes may need to be removed to prevent the cancer spreading. This is known as axillary clearance. During this process, the long thoracic nerve may be damaged, resulting in winged scapula. Thank you so much.